Dr. Dannie Ritchie is a family physician. She's a clinical assistant professor of family medicine at Brown, and she has been working with Ocean State Action and others in Rhode Island on policies and social conditions that affect our health, our healthcare system, and our well-being. She heads up the Transcultural Community Health Initiative to address health disparities and equity in Rhode Island. When we mean healthcare for all, we mean healthcare for all. Dr. Ritchie.
Thank you so much for inviting me, and I'm going to start with my punchline. Social policy is health policy, okay? And I'm going to take the time to also broaden our perspective about health, because we often get it confused with the healthcare system. We have, in Rhode Island, very good health coverage compared to other states. It's always talked about, we're rated #1 in the nation constantly. But when you look at our health outcomes, we're sicker than many folks in the rest of the country. So while we have this care, we're still sick. So there's there's a disconnect, okay? And it constantly happens because, even as President Obama recently said and has been talking about, what we have is a sick care system. We have a disease care system, okay? And it's not a health care system. It's not about taking care of our health. So when you go to the doctor, this health care has been so that it goes and it treats your illness, it treats your disease, but the lack of it isn't necessarily why we're sick. Okay? And so we have to start thinking about why we're sick. It's like saying that because aspirin cures a fever, that not having aspirin is why we have the fever. Okay? And we do that constantly when we keep talking about health care. Health care is important. Having access and appropriate coverage is important, and it's one of the determinants of our health, but it's not all of the reasons for our health. What we have is, if we're really interested in taking care and serious about our health and healthcare reform, and controlling even the outrageous cost of our health care, we must address health disparities and health equity. And our overall health is determined by social and our economic environment. The policies that create how we live and where we live affects the air we breathe. It affects our access to good paying jobs. It affects decent housing and our quality of education. And the availability of healthy foods. These are all the things that determine whether we as individuals are going to be healthy and have healthy communities. We in the US, of all the industrialized countries, have the worst inequities and inequalities. And we have the worst health outcomes. Okay? That's what we're seeing, is that our inequalities in our quality of life, in the equitable distribution of goods, is what is affecting our health. What we're paying for in our healthcare system is 80% for chronic disease, okay? And we're getting that chronic disease because of inequitable systems. When you look at other countries that have universal care and they say they have better health outcomes, well, the fact that they have universal care is really a reflection of that they have more equitable systems. They're providing for their countries. Okay, so what we have to do is we have to start thinking about how to take care of ourselves and how to make more equitable societies, how to make sure that we're getting the goods that we need in order to be a healthier society. So that really gets into the issues around prevention and changing a healthcare system that's really talking about going outside of just when we come in to be sick, All right, we have to make sure that our environment and that we are having our representatives create policies that create conditions that we can live healthier, and that's what's going to cut our costs. And making sure that we have public option and that we have universal coverage is going to be one of those ways that is going to make sure that we're starting to move to a more equitable society and better health.
Thank you.
Thanks.